For more, we're joined by Juliana Chan. She is the Chair Professor of Medicine and Therapeutics at the Chinese University of Hong Kong. Juliana, thanks for joining us.
Thank you, Michelle. Thank you.
Juliana, according to the International Diabetes Federation, more than 100 million people in China have diabetes. It's the highest rate in the world. To put that in perspective, in the US, it's around 30 million people. What is behind this tremendous increase of diabetes in China?
Well, during the last 3 decades, the GDP of China has gone up by more than 88-fold, from just over $400 to $4,000. And during this same period of time, the prevalence of diabetes has gone up from less than 1% to more than 10%, as we have just heard. This economic growth is associated with a lot of societal changes. We've heard about the changes in terms of the way how we eat, a lot of high-calorie food, for example, sugar-sweetened beverages, particularly fruit juices, bottled drinks. People are also eating a lot more meat and fat, and this has, and also the sort of use of automobiles, and also living in high-rises and office works has pushed the rate of obesity and also overweight, affecting 1 in 3 people. But very importantly, in China, for example, 50% of the men are smokers, and there are now good evidence suggesting that sometimes smoking can also damage the beta cell, which secrete insulin, which is the only hormone that would reduce glucose. And there are also now data suggesting that a lot of the environmental pollutants can also cause obesity and damage the beta cell. So all these factors really interact in a most complex manner and unmask the disease in those people who've got a genetic predisposition with reduced beta cell reserve, as well as in those who are more socially disadvantaged because, you know, generally they have lower education, lower awareness, they usually have more risk behaviors and also have poor access to care and delayed intervention. So it is true that this is really a societal phenomenon which has now turned into a personal and medical problem. So we need a societal solution to try and beat this problem.
Well, this is a big problem, but it's also presenting an opportunity for drug companies, Eli Lilly, Merck, Novo Nordisk, all making huge investments in China, establishing their presence there already. How big is the market for diabetes drugs in China?
Well, I think diabetes, in a way, is a product of modernization. And so, as with many products and services, there will be needs, and they will generate a lot of needs. And these are really just part of the healthcare needs. Drugs are very important in the management of diabetes. As I said, this is not just a lifestyle problem. It is a biological problem. People do not have enough insulin to cope with this huge amount of energy. And so drugs can actually help to control glucose. So 100 million people, but not everybody needs drugs, because if these people are diagnosed early, and diabetes can be managed very early on, it's easier just by changing a bit of lifestyle, losing a bit of weight, and they might not need the drugs. However, having said that, some people do need these drugs in order to control the glucose, in order to reduce those very devastating complications which are very expensive and difficult to treat if the glucose is not well controlled in the first place.
Well, about half of China's diabetic population have been diagnosed. Only 15% of those diagnosed are actually receiving treatment. What efforts are being made to increase awareness about diabetes across China?
Well, I think you need a multi-pronged approach. The government is doing a lot. I think you need a lot of social media to actually educate people. Also, you know, people should be counting their own risk factors. All of us, whether we are men or women, whether we are young or old, or whether we are rich and poor, because diabetes can affect anybody. And by counting your own risk factors, for example, if you are a smoker, if you are overweight, if you've got family history, you've got gestational diabetes, or you have high blood pressure and cholesterol, because they all go together with diabetes, then you should really go and get tested. And if you are detected to have early diabetes, that is the golden moments when you can actually be managed quite easily. If you can just change your lifestyles, be a bit more vigilant, monitor your glucose, monitor your blood pressure, monitor your body weight. Now, if you need to take medication, very often in the early stage, you only need to take a few tabs, a few pills, rather than delaying it, because that would actually control the disease. If you delayed it, then actually there will be more complication, more risk factors, and more drugs will be needed.
Well, let's talk about these drugs. What is the average cost to treat type 2 diabetes? And what is the overall economic impact of such an increase of diabetes across the country?
Well, of course, the treatment of diabetes is not just about drugs, okay? It's important to emphasize that, there are other resource implications, because these people need education. Once you lose that control, the insulin control, then whatever you eat, whatever you do, whether you think you're happy, you're not happy, they can all affect your glucose. So that is an important resource that the government must invest, and that is, having a good healthcare system where people can access to professionals, where they can teach them, about the nature of the disease, how to look after themselves, minimize the risk. So that is an important point, because by investing in that infrastructure and that capacity, then fewer people will need these medications. Now, having said that, the medications is important part of management. And generally speaking, if you got complications, the cost will be 3 times that of those without complications. For example, using Hong Kong as an example, in a very early stage of disease, you just need metformin, which is really costing less than a few cents per day. And even if you need a few other drugs, they are very often less than $1 or $2, $3 per day. But that can actually protect your health, rather than actually after a few years, you have to pay $500,000 in order to save your heart, your kidney, your eyesight, or life.
All right, we're going to have to leave it there. Thank you so much. Juliana Chan, Chair Professor of Medicine and Therapeutics at the Chinese University of Hong Kong.